Quoting Mentorius RBG, real change, enduring change happens one step at a time. I'm Tiffany Nelson, Executive Director of the Georgia Rural Health Innovation Center at Mercer University School of Medicine. Joining me today is Natalie Rogers and Joan Anderson to share our experience in bridging the gaps in rural healthcare. I had the pleasure of working with both of these ladies, and together we share a passion for change in rural healthcare. In 2018, Georgia lawmakers dedicated special funds to establish the Georgia Rural Health Innovation Center at Mercer University School of Medicine. The center's responsibilities are ambitious, charged with confronting the complex healthcare challenges and wellness disparities facing rural communities. As a part of the grant requirements, the center would reside within a post-secondary academic institution that focused on the rural and underserved areas of the state. That institution would be the Mercer University School of Medicine. The Mercer University School of Medicine boasts a long-standing commitment to serving Georgia's rural health needs, with a mission to educate physicians dedicated to tackling the health challenges in rural Georgia. Additionally, the school is recognized as an NIH Center of Excellence of Rural Health. The Mercer University School of Medicine prepares our newest physician workforce, teaching the importance of patient-physician relationships and emphasizing a team approach to healthcare delivery. This past August, the Georgia Rural Health Innovation Center, together with Mercer University School of Medicine, began offering the nation's first PhD in rural sciences. Another example of innovation showcasing a combined experience, vision, and leadership, preparing the next generation of rural health professionals. Legislators identified and established numerous charges for the center, to include developing a research program, analyzing significant health system problems, and proposing solutions to those problems. The group accepted the challenge and serves as a trusted vehicle guiding change. We are resolute in obtaining primary source data, keeping it updated and relevant through ongoing community participation. We remove silos that inhibit community engagement. We believe rural communities are great places, essential to Georgia's prosperity. The Georgia Rural Health Innovation Center helps those communities reach their goals and achieve positive outcomes through community-led collaboration. The center is tasked to synthesize existing studies, reports, and data to provide a baseline assessment and to set measurable goals as part of Georgia's strategic reform plan and incorporate recommendations from the state reform efforts. The Georgia Rural Health Innovation Center carries out several legislative mandates related to fiscal responsibility and the appropriate allocation of healthcare resources. These include a focus on access improvement to affordable health care to rural Georgians, evaluating rural health care delivery systems for fiscal stability, and providing recommendations for improvement when those needed. To develop, track, and evaluate statewide pilot projects that include innovative funding approaches, and to eliminate barriers and reduce those healthcare costs by conducting studies that address cost drivers and the duplication of services. At the Georgia Rural Health Innovation Center, we also proudly serve as home to the Georgia Rural Health Data Hub. To create and maintain the Data Hub, the center conducts primary source data collection, research, and partners with a central health repository, ultimately serving as a clearinghouse for data research and analysis. We take a targeted and focused approach and utilize unbiased, dependable data, and the center addresses a multitude of rural healthcare issues. The Georgia Rural Health Innovation Center partners with Georgia's rural communities and commits to improving healthcare through our mission, reliable research, creative strategies, and sustainable solutions. We bridge the rural healthcare gaps using 4 values that serve as a foundation for the Georgia Rural Health Innovation Center's success. Trust, commitment, collaboration, and innovation. Trust based on a community's collective wisdom and shared history is the foundation of building sustainable and successful collaborations. The center serves as a critical resource to rural communities, improving access and effectiveness of healthcare. Keeping a constant community focus, listening and applying shared knowledge while allowing the stakeholder to steer the conversation. They know it, they live it, and they care about it. Georgians want positive outcomes regardless of their geographic location. A grandmother in Bainbridge seeks remission from cancer diagnosis just as intently as a grandmother in Buckhead. The center understands that an urban or Atlanta-like approach to gaps in rural healthcare will not work. Understanding these differences in healthcare infrastructure and delivery mechanisms in rural communities is imperative to bridging those gaps. We find innovative ways to close the gaps that deter the continuation of comprehensive quality care. When applying a community-specific approach, we start by identifying the current healthcare opportunities available within a demographic area and facilitating collaboration between those points. Our goal is to be proactive in rural healthcare delivery, not reactionary. We have a commitment to focus solely on Georgia's 120 rural counties. These counties hold a population of less than 50,000 citizens and are prioritized by need. The individuals within a rural community represent different cultures, age groups, and their needs. We appreciate the tremendous diversity within rural Georgia communities and have assembled an esteemed group of advisory board members and built our Georgia Rural Health Innovation Center workforce to connect easily with all rural Georgians. The center has selected a team with numerous lived and professional experiences and celebrates diversity in our culture, background, education, and talent. Today, I have the pleasure of participating on this panel with two of those team members, Natalie Rogers and Joan Anderson. Both bring a wealth of knowledge and experience. Regardless of color, creed, or culture, the center builds on the foundation of trust to instill our commitment to those experiencing health disparities. The Georgia Rural Health Innovation Team commits the time and skill necessary to close healthcare gaps for our state's most vulnerable populations. Whether it's completing a rural community needs assessment or providing primary source data to develop new projects, the center is guided by our vision of a healthy Georgia and the grand challenges identified by the Mercer University School of Medicine. In a few moments, Natalie and Joan will use those grand challenges as a framework for sharing the identified barriers within healthcare and how they impact specific groups within rural communities. Natalie will discuss bridging gaps related to social determinants of health, healthcare infrastructure, health literacy, healthcare availability and access, and also our physician workforce shortage. Followed by Joan, who will dive into mental health and substance abuse, rural occupational health, maternal child health, and aging populations. At the Georgia Rural Health Innovation Center, we seek collaboration resulting in partnerships that drive the change. Through a strength-based approach, the Georgia Rural Health Innovation Center concentrates on the rural community's inherent strengths, solidifying participants' trust and commitment to ultimate success. Not only do we collaborate with each demographic, but we also look outside of conventional collaborations to enhance existing strengths and introduce new opportunities to close the healthcare loop. Bringing healthcare information to the rural community in a clear, concise, and comprehensive manner that makes collaboration work. In the right scenario, by applying the same premise to external stakeholders, we present ourselves with an additional partnership and collaboration opportunity. Unlike any other community collaborator, the center provides an unbiased source of quantitative, vetted, credible data that makes it available to the communities that we serve. The group created the Georgia Health Data Hub, a one-stop shop for health information pertinent to rural Georgia, providing interactive reports, charts, and maps. The Data Hub allows users to deep dive into Georgia's health data at their convenience based on their informational needs. Building on trust, commitment, collaboration, and innovation, the Georgia Rural Health Innovation Team is teed up to create, develop, implement, and facilitate community-specific and tailored interventions, education, and training. Some of those include our Georgia Hospital Leadership Training and Certification, the Live Well Twigs program. This is a community health program designed to engage and support healthy living in one of our rural counties, Twigs. The Young Georgian Medical Minute, in collaboration with the Mercer University School of Medicine, providing virtual education available to educators and to youth ages K through 12. The Mental Health First Aid Training, which is made available to community members, first responders, and educators. I will now turn the presentation over to Natalie Rogers to begin a dive into our grand challenges and share some specifics.
Thank you, Tiffany. I'll start with social determinants of health. Consistently working for or against an individual's overall well-being, social determinants of health are barriers known to impact healthcare access for our rural citizens. Meaningful health promotion and advancement in health status are only possible when the underlying social determinants are addressed and leveraged. Working with rural communities, we have developed some creative strategies to address social determinants of health. One example is evaluating existing services, building upon them, and offering recommendations on how to expand these services with a focus to improve food security and improve educational programs targeted to improve health literacy. Next, healthcare infrastructure. The collapse of rural healthcare ecosystems and the uncertain future of many rural hospitals has jeopardized the health status and economic viability of many vulnerable communities across the state. For instance, in the last 2 months, 2 rural hospitals have announced their pending closure. Addressing the impact that these closures will have on our rural communities, in addition to stabilizing, strengthening, and growing the rural healthcare infrastructure, is a critical part of ensuring the citizens of rural Georgia have access to high-quality care. Key factors to maintain the viability include addressing and enhancing electronic record keeping, telehealth availability, and strategic asset development. In collaboration with our rural partners, targeted areas for innovation include practice models that support continuity of care and repurposing existing infrastructure with a focus to highlight and build upon local resources. These next 3 grand challenges, health literacy, healthcare availability and access, and physician and health workforce shortages, present an excellent opportunity to evaluate the importance of physician-patient relationships and allow community pharmacists to gain more of a presence on the healthcare team. Focusing on each community's strengths, our commitment to meet each community where they are employs a strength-based approach to improving healthcare access. Pharmacy practice has evolved from medication dispensing to providing pharmaceutical care, a deepened patient-centered focus. Today, pharmaceutical care is a practice model designed to yield positive health outcomes and quality care. As rural hospitals close their doors and the list of primary care providers continue to shrink, more patients rely on their local pharmacy for their healthcare needs. This welcome change places greater demands on community pharmacists and their staffs, presenting an excellent opportunity for health professionals to collaborate. Partnering with rural communities, targeted areas for innovation include increasing pharmacy availability, developing and deploying allied health professionals, and addressing the nursing shortage. Too often, far too often, patients are not part of their own healthcare decision-making processes. For example, when a health plan limits patient-pharmacy interactions with attractive, cost-saving, direct delivery dispense models, direct communication between the pharmacist and their patients is almost often eliminated. Recently, in Georgia, our legislators have signed House Bill 233 and House Bill 323, two bills that protect patients' access to care, are recently available and are in use for our efforts to ensure patients have control and a voice in their care. House Bill 233 is a bill that protects patients' choice and prohibits pharmacies affiliated with prescription benefit managers and insurers from profiting off of prescription referrals. Further protecting patients' choice, House Bill 323 strengthens anti-mandatory mail order, adding additional audit protections and restricting data mining of patient data. Third, health literacy. Faced with limited resources, the need for assistance with the management of healthcare issues presents a unique opportunity for improving health literacy for our rural community. Health literacy is the foundation on which quality life is based. An individual's ability to understand their health, advocate for their healthcare needs, and successfully navigate the healthcare infrastructure are essential skills for a healthy, productive life. Nowhere are these skills more valuable than in a rural context where additional barriers and disparities further complicate the healthcare landscape. Working with rural communities, the Georgia Rural Health Innovation Center targets early health literacy programming and health information communication. Fourth, healthcare availability and access. Coordinating patient care depends on being able to connect the dots. Connecting patients with the right care at the right time in the right context is a key driver of quality and cost. A rural context often adds additional layers, complicating the process, all the more reason for collaborations. Within rural communities, targeted areas of innovation include new models for providing needed services, expanding the network where services are available, developing new models for acute care management, and stabilizing our hospitals. Last, healthcare workforce shortages. At the core of the healthcare system are the communities we serve and the healthcare workforce. The healthcare workforce includes those who breathe life into the system. Georgia is currently feeling the sting of physician and health workforce shortages. Nowhere is this more acutely felt than in our rural communities of Georgia. While partnering with our rural communities, targeted areas of innovation include the development of a stable primary care workforce, and the development of allied professionals in the health field. Now, I will turn it over to my colleague, Joan Anderson.
Thank you, Natalie. So healthcare concerns of populations with rural communities are the topics I have the pleasure to talk about today. I'll start with mental health. Mental health often is stigmatized and it is a minimized component of an individual's well-being. Unchecked mental health concerns often lead to reductions in an individual's quality of life and lifespan, as well as manifests into significant disability burdens on those affected. Rural citizens often must travel significant distances to access psychiatric or counseling services, thus serving as major disincentive to treatment beyond the existing stigma and other barriers to access. Working with rural communities, mental health innovations include promoting a culture of change and the attitudes toward mental health, while strengthening the mental health resources within the primary care environment. Concurrently, by working with other agencies and providers, a rural safety net for mental health crises and services may be constructed and fortified. Substance abuse. Substance abuse impacts many individuals, and that impact is experienced by their families, their employers, and their communities throughout rural Georgia. Substance abuse disrupts family systems and communities. These consequences of substance abuse ripple into the economy and also the health system. For example, those affected by substance abuse interact much more with emergency services. The burden of substance-related deaths and overdoses is a destabilizing factor in many communities, and it stretches our already scarce resources to the breaking point. While partnering with rural communities, targeted areas of innovation to address substance abuse include substance abuse prevention education for the K-12 students and healthcare practice models that minimize opioid use. Additionally, by strengthening the intersection between mental health and substance abuse, greater collaboration can take place. In the areas of maternal and child health, we see a great proportion of our population. Women in their roles as mothers, daughters, grandmothers, aunts, nieces, sisters, and granddaughters are often who serve as the generational anchors for our families. Women are the key healthcare decision makers, and they have tremendous sway over a family's health status. Unfortunately, though, many rural Georgia women have difficulty accessing quality healthcare services, and as a result, endure poor healthcare outcomes. Nowhere is this more acutely understood than in Georgia's maternal mortality rate, which is currently more than double the national average, and we are ranked last in the nation. For children, a healthy childhood is the foundation for a healthy, productive life. Steps taken to promote health and well-being early in a child's life pays dividends for decades to come throughout their life. Presently, the high rates of infant mortality and poverty, which in Georgia, 21% of our children live in poverty. Also, issues of obesity and other indicators of poor healthcare plague our rural children. There's high rates of adolescent risk behaviors and pockets of low educational attainment. These further complicate a rural child's path to a bright future. Targeted areas for women and mothers include strategically increasing their access to both OB and GYN services, strengthening and standardizing the continuum of care both pre and post-delivery, as well as addressing violence prevention. Targeted areas for innovation to address needs in the children and adolescents. One is infant mortality. Right now, infant mortality in Georgia is at 7%, and we're tied with Alabama with a rank of 43rd in the nation. Our low birth weight. In Georgia, the low birth weight percentage is It's 10% versus the US average of 8%. There's issues of child abuse prevention we'd like to address, child obesity, partner with schools and school-based healthcare, substance abuse prevention, truancy reduction, the teen pregnancy issues, and STD prevention. Rural occupational health. Rural Georgia's industries are a Georgia hallmark and bring great opportunities to our citizens. It's the engine that drives Georgia's economic success. However, these industries often are accompanied by risks requiring very thoughtful mitigation. These risks are trauma, chemical exposure, and intense manual labor in all seasons, all climates, and in various settings. These are all components to mitigate in rural industries. By collaborating with industries and communities in rural Georgia, we can address trauma treatment, both the physical and the mental trauma. We can address trauma mitigation and injury prevention. We can also enhance and address the environmental exposure mitigation. A phenomenon across the whole United States is the aging population. As baby boomers increasingly reach retirement age and their senior life cycle, the entire nation is facing the challenge of responding to the unique needs of older adult populations. In rural Georgia, we're disproportionately older. Of the 100 oldest counties in Georgia, 94 of them are rural. The aging of Georgia's rural population is leading to an increase in healthcare needs and demands in communities that historically have already been underserved. The challenges of healthcare access and availability of the varied and unique healthcare needs of an aging rural Georgian population further stress an existing infrastructure and a system of care. Thus, this opens tremendous opportunities for collaborative innovation by applying a community's knowledge and experiences and the identification of a rural community's strengths and assets and adjusting the systems of delivery and processes to achieve optimal outcomes. So back to Tiffany.
Thank you, Joan, and to you, Natalie, as well. In conclusion, we wanted to thank each of you for participating and sitting with us in today's panel presentation focused on bridging the gaps in rural healthcare. We encourage each of you to be the change regarding matters for which you hold a passion. Thank you very much.